I am the founder of PAUZ Health. We are a virtual menopause clinic for women. We have menopause certified nurse practitioners that do assessments and treatment for women in menopause. So I started PAUZ out of a necessity, understanding that women get no access to education and information about menopause and struggle to get care and treatment. I spent most of my 20s, 30s, early 40s chasing outcomes. I got my PhD in public health, not because I was passionate about being an academic, but because it was the highest level of education I could get. I was doing marathons and Ironman while balancing 2 children, trying to be the perfect mom and keep the perfect family, even though I was drowning in my marriage. I tied my value to professional title and wouldn't think I had value until I was CEO. Even though I was vice president of a large telemedicine company, I never stopped to think about the success I'd had. It was always what's next. And then perimenopause hit, and the scaffolding, which are your hormones, let go. I could no longer keep going on no sleep, poor nutrition, relying on antidepressants and exercise to keep me stable. My life went through a series of explosions. I tore one hamstring and then another, so my very outlet of exercise was no longer available. I left my husband and pulled the rug out of my children's safety net. At work, the job I was passionate about and loved, I could no longer find any purpose. I struggled to figure out what I needed to do for the day, daydreamed about hiding under my desk, hung out in the washroom a little longer because nobody could find me. And finally, my worst day, maybe my best day, I had a complete meltdown in the boardroom. I left my job, started to dive into the research, reading every article I could find, every self-help book, talking to every expert in the space. And when I finally got help and learned I was in menopause, I started hormone therapy. For me, hormone therapy combined with exercise, nutrition, and sleep have been a game changer for me. I've now stepped into who I am and am grabbing life by the ovaries. Currently, women are unaware of the symptoms of perimenopause and unaware of not just the symptoms, but the long-term health risks. Currently, family physicians don't receive training in menopause unless they seek it out. Obstetricians and gynecologists get 1 to 2 hours, and if you do find a menopause public clinic, you can wait 18 months to 2 years to get help. There is a need to provide easy access to women, no matter where they live, to get the care and treatment that they deserve. Well, we can keep continuing to educate our providers in menopause and partner with companies like myself to help support women getting care.